Most kids wanted to be the president or a fireman when I was growing up. I wanted to be a plastic surgeon. I am a triple board certified aesthetic, plastic, and reconstructive surgeon. My job is to improve people's lives. At a young age of 8, a family member of mine had a tragedy that required multiple plastic surgeries. I realized that becoming a plastic surgeon allows me to provide people a new start in life. It's very important for me to have a close relationship with my patients. It allows them to drop any barriers. That also helps in the process. They feel comfortable, I feel comfortable, and we could work together as a team. What I learned over the years as a surgeon is not necessarily something medical, but more on a personal level. I have to understand what that patient views as beautiful. Beauty is something that you can't just find in a book. It's an emotion. And if it's something that we can manage, that's great. We're all on the same wavelength. If it's something out of the norm, then it's my responsibility, not only as a physician, but an educator, to educate them on the reasoning why that would not be appropriate or why something else would be appropriate. We're seeing younger people come in for plastic surgery because of social media. Now you could view social media as a form of sometimes bullying or peer pressure. If that's the reasoning why they're coming in for plastic surgery, then it's my responsibility as a physician, as an educator, to protect them. You know, we've taken an oath to protect our patients. When women have had mastectomies, psychologically and functionally it affects them if it's not corrected. And as a plastic surgeon, it's pretty rewarding. By not only functionally repairing what was taken, it improves them psychologically also. And by balancing both the functional and psychological aspects of that surgery, we notice a change of life. At my office, we came up with the concept of shrink wrap liposuction. It's been on multiple TV programs, Dr. Oz, Entertainment Tonight, Univision, etc. And what we're doing is not approaching liposuction in a standard form. It's not a cookie cutter approach. Each patient's care and treatment is individualized, so it's more of a customized concept, where what we've done is brought in the best of the best platforms of liposuction, and sometimes we combine 2 or 3 of them to get the great result that we're getting and achieving in our patients. Additionally, what we're seeing is body transformation like no other, and that's why patients come to us. It's basically like changing type of surgery where patients get so motivated by the result that they're not only changing their concept of life, they're changing their lifestyle, the diet, in addition, fitness, and it's almost like they're looking at it as a second outlook in life. My ultimate goal as a surgeon is always to be an educator. The concept is to kind of pass the baton to the next generation, to continue with excellence in treatment, but also to maintain the quality of plastic surgery. That's the key factor. As plastic surgeons, we train immensely, and it's a long training process. And we should always strive for high standards, and hopefully they could build on that foundation and take it to the next level. You know, sometimes a person has a passion for something, and this has been my passion since the age of 8.